here, and this is an honor for me to present some of our results that we are doing together with Dr. Jose Vicente, our people. So we are working on this area since last 30 years or so, blood-brain barrier. Also we work part with Jose Vicente in Free University Berlin under Professor Sarvas Navarro. And this is an organization supported by various organizations in the United States. Okay. So I would like to share first that whatever I am speaking and presenting to you is my personal opinion and not the opinion of the organization or the US government or Swedish government. I am working with them. As I told you, and you are aware, being in neuropharmacology and other disciplines, that blood-brain barrier is very important for all kind of brain diseases, and we have the data that showing that whenever this barrier is disturbed, we are going to have brain diseases. And in particular area, we focus on endothelial cells because they are even much more higher in number than in neurons and glial cells. My interest goes back to 1982 when I did a thesis on this topic in India, Banaras Hindu University. We are still collaborating with that organization. And what we always feel that whenever this capillary is leaky, it can influence the neuronal and glial functions. So what we are working nowadays that try to understand in several disease conditions, experimental models, and then we also use drugs. And now since last 10 years or so, we are also using nanoformulations to protect this barrier and also the pathological changes. It is quite clear that whenever we have this leakage of the capillaries, we can influence both neurons and glial cells as well. As you are knowing very well, that the first demonstration by Brightman and Rees that the tight junctions are the basic aspects of the blood-brain barrier, but we have added another aspect that was not discussed at that time, that not only tight junction but this endothelial cell membrane is also a very effective barrier, and it plays an important role in neurological functions. Here we work together with Jose Vicente in, as a Humboldt Foundation with Sarvas Navarro. My wife is still here. So we reproduce this laboratory experiments in spinal cord, and this is lanthanum we use. This is 12 angstrom in diameter. And in healthy situations, it is not leaky. This is a normal case. And nowadays, we are also working to study this, on the other side, this brain-blood barrier that is also understood to be quite tight, but not so much studies has been done showing that the abluminal side of the barrier is also broken down in same situation. We formulated a theory that tells us that whenever we have CNS insult or neurodegenerative diseases, this blood-CNS barrier is broken down, producing edema and all other gene expression leading to cell death, and we are still working to accept or reject this hypothesis. Of course, our interest is recently working with US Air Force Research Laboratory on nanoparticles, how they can influence the blood-brain barrier or how they can influence the disease processes. So therefore, these aspects are also very important at the moment. And we have some collaboration also with known Nobel laureates. This is Andrew Shelley in physiology and medicine. He got in 1977, and we are using some of his fragments to nano-deliver and trying to see that whether we can reduce some of the pathological changes in experimental Alzheimer's disease models. I am basically a neuropathologist trained under Yngve Olsen at Uppsala University in Department of Pathology. And And our main interest in research is neuroprotective agents, and that's why we are very happy that with the help of Professor Jose Vicente, 13 ICRA Congress will be held in Bilbao. So we are very happy for that. Coming to the blood-brain barrier, we know that various kinds of insults can influence the neurological diseases, and in these circumstances, I have just listed trauma, ischemia, hypertension, drugs, chemicals, even osmotic solutions, hyperthermia, all can influence blood-brain barrier. But the question is, how much stress or how much insult we need to open the barrier? Is it universal or different time periods? I just listed some of the observations, and it shows that even 30 minutes of training in water maze or 7 days of bilateral adelectomy, starvation of 48 hours, and these are some of our observations. Immobilization stress 8 hour, 4 hour. This table gives you the idea that blood-brain barrier is more dynamic and functional. It can open with even a small stressor, as we can say. But the point is that the second question is, what is the functional significance of opening of this barrier, or whether it is a breakdown for longer period, or it is just opening for some adjustment. After that it becomes reversible, and then the physiological functions are working similar way. We have no answer at the moment. Drugs of abuse is another problem, and there are lots of studies going on. We were able to show for the first time in 2006 that methamphetamine can also open the barrier, probably due to its hyperthermic effects. Hyperthermia is also nowadays very important aspect in our lives, because you have seen recently that the earth temperature has increased by 1 degree Celsius. There is some data suggesting that every 10 years we have an increase of environmental earth temperature 1 degree Celsius. It can also affect our human brain and functional diseases that we can have. So we are also focusing something on these hyperthermia, that is very important aspect. As I told you earlier, that heat-related deaths are very important, occurring everywhere in the United States, in Europe. Now people are much more aware, but we still do not know that whether these hyperthermia or environmental heat stress can also influence neuropharmacology of drug treatment in disease processes. The other questions that we are working, that if we have disease, certain kinds like hypertension, diabetes, and we have hyperthermia, and in those circumstances, whether we get traumatic brain injury or any other diseases, we feel that the same kind of drugs are not important to heal the process. We must understand that we have to consider these comorbidity factors while treating diseases. Working with US Air Force and European Office of Aerospace Research and Development, we came to know that there are various situations that our military faces in the battlefield. And for example, here is silica exposure is quite common when the military is stationed, either combat or non-combat operations in the desert area. They are exposed to silica daily. The other condition is that when we want to keep our borders alert, many military officers or soldiers, they have to be in this position for a long time. This we consider immobilization stress. So what will happen for the long time? They are exposed to silica, they are exposed to high heat, and also the stress. So we try to do some laboratory experiments and to see how and when the blood-brain barrier is broken down. So we have a model that this is the immobilization stress partially, and this is the biological oxygen demand incubator. There are several conditions. The first thing, that whether the stress can enhance the effect of hyperthermia, and also if it is done at different ambient temperatures. For example, this is the control. We have made also the animals hypertensive, and this is 2 kidney 1 clip for 1 week, 2 kidney 1 clip for 4 weeks, And then we have subjected to immobilization at 21 degrees Celsius and 33 degrees Celsius. And then we have also exposed silica. These are different combinations. I will show you some only key points. Here it says that the mean arterial blood pressure directly depending on the ambient temperature and cardiovascular conditions. It means that there is hypotension when we have subjected to hyperthermia in immobilized stress animals. And there are some changes at 21 degree and 33 degrees Celsius here. Can it also affect the behavioral functions? And we have used very simple rotor and inclined plane angle tests. And here you can see that silica intoxication reduces rotor rod performance after the stress at high ambient temperature. These are the normal situations, and I'm sure most of you are familiar with rotor rod experiments. So the point is that you look about that here, that immobilization stress at 21 and 33, there is drastic reduction in the performance, and silica toxicity has also reduced the performance on these. So the point is that high ambient temperature and silica exposure together with the stress all have additive effects on behavioral function. And this is the inclined plane test. You can see also this immobilization, hypertension and silica exposure at high degree 33 has the worst effect as compared to the other situations. So these are the summary results. I am showing you some example of blood-brain barrier leakage. There are different areas here: the cortex, hippocampus, striatum, thalamus, hypothalamus, spinal cord. We can see that hippocampus and thalamus, they are worst affected when the stress was given together with silica exposure and 33 degrees Celsius. So the point is hypertension plus silica exposure, immobilization, 33 degree were worst affected the brain function. This is brain edema. Of course the scales are wide, but you can see here that the brainstem, spinal cord were worst affected, and also the cortex and hippocampus when we have silica exposure to immobilized stress animals with hypertension at 33 degrees Celsius. The same thing is happening with damaged and distorted neurons. There are different areas. Cortical damage is very high, hippocampus, striatum, thalamus. These are the 33 degrees Celsius hypertensive immobilized stress with silica exposure. Some of the changes in cerebral cortex you can see here. There are hypertension for silica at 21 degree and the same situation at 33 degree, much worse situation. And these are the normal conditions. Neural injury in heat stress, hypertensive alone can produce much more neuronal damage as compared to the normotensive group. What could be some mechanisms? These are very large collection of data. I have very less time, so I am only showing you some example. We understand that neuronal nitric oxide could be one of the important agents that can produce hyperthermia, induce brain damage. So we have applied the effect of some cytokines. We use TNF alpha. TNF alpha, some people say that it is for good purpose, some say it is for bad purpose. So we have applied TNF alpha antibodies on heat stress in normotensive, and when we have applied TNF alpha plus when we have given nanowire delivery of TNF alpha antibodies, we can have still very nice protection. So it appears that TNF alpha has some damaging effect in these situations. Here is another, you can see neuronal nitric oxide synthase upregulation is very high in normotensive and much more exacerbated in hypertensive cases. When we have given the same thing, TNF alpha antibodies, feeling that TNF alpha could be one of the crucial agent in cell damage, we can see that it is much more protecting. But when we have given nanowire delivery of TNF alpha, we have much more better effect. So this suggests that nano delivery of the same compound can have much better effect in same kind of insult and reduce brain pathology. How much time I have? 20 minutes. Okay. Then these are the cases we are working with Dr. Jose Vicente, and we made a model of diabetes. And here you can see that when we have combined diabetes, this was produced by a streptozotocin in animals. Silica exposure is much more worse on albumin leakage. And here is only diabetes plus saline and only SiO2 plus saline. So much more leakage of albumin in the brain. Here the same category has much more neuronal damage as compared to the other situation. And at the electron microscopy, these were done here in Jose Vicente's laboratory. You can see here that diabetes plus SiO2 giving maximum myelin vesiculation as compared to the other situation. So the point is that when we have any kind of hypertension or diabetes, if we are subjected to another injury or exposure, we have much more neuronal damage than the normal animals. Our strategy is that nowadays every laboratory uses healthy animals for doing experiments. So therefore this could be one of the important aspects that the drug development may not be that right that we are working on only normal healthy animals. This is one of the messages that on which we are working. Now the question comes, we are talking about nanoparticles. Whether the size is important, size of nanoparticles, or even the age of animals is also important. This investigation was done by my wife, and this was presented in neuroscience. I will briefly go through this. So our question is whether nanoparticle size or age of animals, both are important or not. We have recently published this work in molecular neurobiology together with Professor Jose Vicente. We have chosen the size range of 20 to 30 nanometer, 50 to 60 nanometer, and 130 to 150 nanometer. Age of the animals were 9 to 10 weeks, 18 to 20 weeks, and 30 to 35 weeks. In all these three conditions, three different sizes of nanoparticles were administered. And our parameters were blood-brain barrier breakdown, edema, neural injury, and NOS expression. What we can see here that in one case, that the smallest size of nanoparticles are producing greater damage and the higher sizes of the nanoparticles were producing lesser damage. And age is very important. The young and old were more susceptible as compared to the middle-aged group. That can also be seen here. This is 20 to 30 nanometer. And second question was asked, if we have the nanoparticles in same size, whether the material of the nanoparticles is important or not. Our observations suggest that this is the case because silver is most dangerous in the same size at same age as compared to the copper and even aluminium. Here are the example. This is copper at different groups of animals. Here is silver and here is aluminium. Edema is also following the same way, and volume swelling is also following the same way. These are the nitric oxide positive cells. It is also working in the similar way, means a smaller size of the nanoparticles in young and old animals were most dangerous, but even in the same size of nanoparticles, silver is most dangerous than copper and aluminium is the least. These are the examples of neuronal damages. But under whatsoever circumstances, the blood-brain barrier and edema formation was tightly correlated. So we can say that neurotoxicity is inversely proportional to the size of nanoparticles. Very young and elderly group are more vulnerable than young adults, and copper and silver are more neurotoxic than aluminium. Then we went to study the cell changes, and you can see here also that this neuronal nitric oxide, young adult and old one, copper nanoparticles, and astrocytic elevation reaction by GFAP, by silver nanoparticles, and normal H&E reaction. Young were most affected, as well as the old, but the adult were much less than these two groups. Then we went on electron microscopy. This was also done in EHU, and we have the same result, myelin basic protein. The degradation was much more higher in young and old. An example of electron microscopy is given here. So we can say that nanoparticles neurotoxicity is size related, and age influences the neurotoxicity. Inherent properties of nanoparticles are also very important. Now I will show you some spinal cord injury results with nanoparticles. I can tell you, when we prepare any animal injury model or any experiments, it is almost impossible to recreate human situations. One of the great example, you can see that in human cases, a spinal cord injury occurs when we are conscious, like driving a vehicle. But and this comes on the ventral side. But the animals, we have to anesthetize them to make injury, and also we have to make injury on the dorsal side. So these are fundamental differences. We cannot recreate the same situation, but still we can do some experiments. We also have some brain injury example. There are two different kinds of brain injury. This is concussive head injury, where this metal is dropped on the surface of the skull. No perforation was seen. And the other condition was that we have opened the skull and make an incision. As I told you, that whenever we have neuronal injury or disease, there are many factors are working together. So why we should try to stop one factor or the other, except in experimental conditions? So we found a commercially active drug that is called cerebrolizin, and this is a balanced mixture of several kinds of neurotrophic factors and active peptide fragments. So we tried to use this, and we published a couple of papers knowing that it is working good in our hands. Then we tried to develop these drugs giving by nano delivery, either nanowired or PLGA labeled cerebrolizin. This is Dr. Ryan Tian and this is Dr. Wang. They have the patent of titanium dioxide nanowire, and they label cerebrolizin for our experiments in collaboration. Actually, the nanowire, father of the nanowire is Dr. Yan, but he worked for these nanowiring for electronic purposes. We are also working on nanowiring of stem cells. Some of the abstracts we have presented in Society for Neuroscience in Chicago this year, and we can also see that nanowired stem cells are even working much better than non-nanowired stem cells. Here the example is that nanowired stem cells can live longer. So these are the titanium nanowires we are using in Arkansas, University of Fayetteville, Arkansas. And this innovation we have presented in 2013 at National Innovation Summit in United States that occurs every year. In 2016 it is in May 2025, and if you have any innovation or any technical innovation, I think you should submit your work there. So we have submitted this work, and it was found by the executive committee of the National Innovation of US government. The top 20% of this innovation, nanowire delivery of cerebrolizin for the treatment of neuropathic pain. We were really delighted. And not only that, it is also come on different kinds of spotlights, so we are encouraged and we are working. And I'm also happy that Dr. Jose Vicente has used this nano-delivered cerebrolizin in one of the thesis of this university. That is very great. So I can show you some example here of concussive head injury. The pathology is prolonged with time, So here you can see that 24-hour left and 24-hour right. When we have injury on the right side, since this is concussive head injury, left side is much more damaged than the right side. And it is quite well known to neurosurgeons. So, and 12-hour is less, 24-hour is higher. Then this normal cerebrolysin was given in the same conditions. You can see that there was neuroprotection, of course, both 24-hour and left and right, either given 30 minutes before or 4 hours after. This is 30 minutes before, this is 4 hours after. And in those circumstances, we also tried the dose relationship, and there is, up to certain level, there is a dose relationship, but after that there is no effect, and that is 5 milliliter, 10 milliliter, they are working fine, but 15 is almost same. So you can see that this is the dose of cerebrolysin, left half, and you can see that right half with very closely correlate with blood-brain barrier changes. Then this is the situation of GFAP when the cerebrolysin was given 4 hours before and 24 hours. This is cerebrolysin treatment was much more better than the untreated group. We went to the electron microscopy done here in EHU, and we can see that the neuropil was much more protected when we have given cerebrolysin 24 hours. And here is also cerebrolysin with 10 milliliter, and these are the normal situation where no cerebrolysin was given. So there is a dose related effect of cerebrolysin, and I will show you later that nanowire delivery is much more protective. Now the question I have asked before, that there are all other factors also affecting the brain pathology. Why we fail in clinical conditions when we have very good experimental results in animal model? The question is that it is very difficult to find two identical cases of clinical situation, and there are multifactorial injury that we may not know are the basic aspects. We can't find any good drug that is working in experimental but not in clinical cases. So briefly I will show you some in Alzheimer cases. You are very familiar with these brains, and also this senile plaques that is in human cases. What we have done, that we have infused A beta protein model of Alzheimer pathology, and here we have measured this A beta in cortex in APP knocked out mice. What we can see, if we have given cerebrolysin, the A beta level is much less here. When we have given nanowire cerebrolysin, we have much more better effect. The same thing we have measured with tau, and we can see here that nanowire cerebrolysin was able to reduce the tau level. Here we are working with Dr. Shelley, and we are using some of his CRF fragments. The results we cannot disclose at the moment, but we are getting combination of cerebrolysin and CRF much better when we have given nanowire delivery. That's the CRF fragments we are using. Then we have used spinal cord injury on the dorsal side, this lesion of the one dorsal horn, because we wanted to study the contralateral side. And after silica exposure, you can see that the damage is much more higher. Here is the case in the silica exposure, the complete sponginess and almost complete loss of motor neurons here. We are using, this is the former governor of Arkansas who is helping us with nanowire delivery. And then you can see in this chart that we have used several compounds labeled with same nanomaterial. The point is that if we label 3 different compounds with same nanomaterial, the results will be same because of nanomaterials, or the inherent drug property